The doctor is in, and today we are discussing reconstructive surgery for breast. Get it out. Turning into Nick. I've only been here. He's only been here for 2 days. Almost 300,000 women, if you can believe this, face breast cancer each year here in the United States, and many of those women will choose to have a mastectomy and then reconstructive surgery. Dr. Scot Ackerman is one of the first Coast's leading oncologists. He's here to join us today to talk about this surgery, and also you brought two experts to join us to weigh in on the conversation. Who'd you bring with you?
Yes, I did, Casey. So we have today Dr. Holly Hickman and Dr. Erez Sternberg. They're both reconstructive surgeons, they're plastic surgeons.
Okay.
And they do a lot, we work a lot together. A lot of patients that I see with breast cancer, many of them have had mastectomies. And so a lot of these women need to have reconstructive surgery. And so we work together a lot. And these are two wonderful, very good plastic surgeons.
You know, because when we were looking at that statistic, which I think is just staggering, 300,000 women will face breast cancer each year in the United States. I mean, and I've known people personally who have gone through this. It is a scary thing.
It's very scary, and these patients go through a difficult process. Once they're diagnosed with cancer, they have to deal with how to cope with first of all, they have to cope with the diagnosis. Then they're concerned about treatment options, whether they should have a lumpectomy or a mastectomy, if they need radiation or if they need chemo, how are they going to deal with the side effects relative to that. And they're missing work, and they have intimacy issues. All those issues they're overcome with. And especially women who are going to undergo a mastectomy, there's lots of issues that they need to deal with. And so that's why I brought along Dr. Sternberg and Dr. Hickman to talk to us today about reconstructive surgery. I'm like you.
Okay.
Right?
It's
I'm
contagious.
getting like Nick.
Yeah, he's weighing off on all of us.
But reconstructive surgery and how women who have mastectomies deal with that and what the challenges are.
Okay, so let's bring Dr. Sternberg into the conversation here. When is the best time to have reconstructive surgery, do you think?
Well, that's a great question. It's an important one. You know, there's two main types of breast reconstruction. There's what we call immediate reconstruction and delayed reconstruction. And that's something that's really important. And it's a conversation you'll have with us and your other surgeons to determine when the best time is for that patient, for that specific patient. But in essence, immediate reconstruction is that when we perform the reconstruction at the same time as a mastectomy. Your general surgeon performs a mastectomy, and we begin the reconstructive process that day while you're still asleep on the table. That's great for some candidates, especially with smaller tumors and ideal patients. And then other times we choose to delay the reconstruction, to have the mastectomy first, have the treatment that's appropriate for the patient afterwards, and then we'll come back later, it could be months later after they've healed, to do the delayed reconstruction. Put the implants in, move the patient's tissue, and then begin the breast reconstruction. So those are the two main types. In general, immediate breast reconstructions tend to turn out better from a standpoint of aesthetics and cosmetics.
So, Dr. Hickman, a lot of patients that I see are going to be getting chemotherapy as part of the treatment. So how does that factor in as to when they should have reconstruction?
Well, the mastectomy and the reconstruction, when done immediately, are generally done about 2 or 3 weeks, maybe a month prior to chemotherapy, so that they don't interfere with each other. And then during the chemotherapy, we just don't operate on the patients due to the immune system deficit during chemotherapy. Then when patients are expected to get radiation, then we'll delay the reconstruction until after the radiation, when the skin is healed from the radiation, and then we begin the reconstruction process.
All right, and Dr. Sternberg, let's go back to you for a second, because are there any implications with having this breast reconstructive surgery, health implications or ramifications?
Well, I think it's important to focus on the positive health implications for women. I think in general, it's proven that women who have some sort of breast reconstruction, whether they start at the immediate time or delayed like we discussed, their self-esteem, their mental health and well-being, their family well-being is much more positive. So that's really important. And we know the women who never decide to get reconstruction or weren't offered that just always feel negative about themselves because they don't feel whole. On the other hand, there are negative implications to anything associated with surgery. The risk of surgery itself, infection and bleeding, the risk of forming fluid around your implants, the risk of just losing the implants because of infection. Sometimes we do have to take those out and start the process over again later on. So there are all some negative implications. In general, people ask me a lot, well, what do I do after mastectomy or reconstruction? Do I still need mammograms? Do I still need to perform exams and MRIs? In general, after you've had a mastectomy, you don't do mammograms anymore. It's going to be a self-breast exam. We're going to examine you when you come to our office. Other surgeons and your other medical specialists will examine you. And then we're going to do MRIs if we worry about anything. No longer mammograms on the breast after mastectomies. We will do mammograms on breast after lumpectomies or on the contralateral breast that wasn't affected by cancer. We still do mammograms on those breasts.
So, Dr. Hickman, which women are candidates for reconstruction? You know, not all women that have mastectomies get reconstruction, and maybe
Right.
some of them, there's all sorts of reasons they don't. So help me.
Well, that's a great question, Dr. Ackerman. The statistic is actually very disappointing. That the literature shows that about 70% of women that are candidates for breast reconstruction don't actually get offered breast reconstruction. So that means that 70% of women that are out there that have had mastectomies and have no breast don't even know that they have the option of having their breast reconstructed. So it's so important for women to be their own patient advocate and say, hey, I want to talk to a plastic surgeon. And if you know people, tell them, you know, have you seen a plastic surgeon? Now, once you get to the plastic surgeon's office and they tell you your options and discuss breast reconstruction, at that point you can decide, hey, you know, this isn't for me, I don't want breast reconstruction. But at least you've had the opportunity to have an informed consent that you were given the option, and then you've declined it now. And if you choose to move forward, then you have several options. And there are those patients that may not be candidates, very few nowadays with all the procedures that we're doing, but maybe for health reasons or maybe body habitus may be impeding factors. But that's a discussion between the patient and their surgeon.
Yeah, it seems to me that because there's a lot of newer techniques for doing reconstruction, that women who in the past weren't necessarily candidates are candidates now.
Absolutely. Even when Dr. Sternberg and I started training, they were developing new types of surgeries to include more people. It used to be if you were morbidly obese or obese, you weren't a candidate for breast reconstruction, but now they have options for pretty much everybody.
Wow.
All right. Well, thank you, Dr. Ackerman, and thank you also so much to Dr. Sternberg and
Thank
Dr.
you.
Hickman. Thank you
Absolutely.
both for
Thank you
joining
for
us
having
today
us.
and being our special
Absolutely.
guests. And for any questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.